I'm blessed academic nursing tutor. In this class, we will discuss NCLEX-RN question. That question is related to the condition COPD, chronic obstructive pulmonary disease. Our question is this one: a client with the COPD has developed secondary polycythemia. What nursing diagnosis would be included in the plan of care because of this condition? Our answer options: fluid volume deficit related to blood loss. Second option is impaired tissue perfusion related to thrombosis. And third option is activity intolerance related to dyspnea. And fourth option is risk for infection related to suppressed immune response. So we are coming to the condition first. Chronic obstructive pulmonary disease. This is a condition in which there is chronic airflow limitation occurs, and mainly it is due to two conditions. One is chronic bronchitis, second one is emphysema. The major predisposing factor for this condition is smoking. So what happens in this condition? Patient will be having hypoxemia or reduced level of oxygen in the blood, hypercapnia, increased carbon dioxide in the blood, and also patient will have dyspnea on exertion. That means they are doing some activities, they will develop dyspnea. In addition to that one, there will be cough, sputum production, weight loss. Then there is a special finding in emphysema, that is known as barrel chest. Then if you do an X-ray, you can find hyperinflation of the lungs and flattening of the diaphragm. So this condition is a progressive condition in which oxygen level will be less and carbon dioxide level will be increased in the blood. So because of that one, patients are developing chronic pulmonary hypertension, which can lead to right heart failure and eventually cor pulmonale, and death of the patient can occur. Then our question is related to a secondary condition related to chronic obstructive pulmonary disease. The secondary condition is polycythemia. So polycythemia can occur in persons who are having chronic hypoxemia because of decreased level of oxygen in the blood. The body will try to increase the hemoglobin to carry the oxygen, more oxygen to the tissue. So in that condition, polycythemia or increased RBC will be in the blood. So our question is, what nursing diagnosis would be included in the plan of care of this patient with COPD who is having a secondary polycythemia? So we have learned that polycythemia increases the RBC in the blood. So our answer option, first option is fluid volume deficit related to blood loss. Is there any possibility of blood loss there? No. So we can just exclude the first option. Second option is impaired tissue perfusion related to thrombosis. And we will see the third option, activity intolerance related to dyspnea. So this is a nursing diagnosis which can be included in COPD but not related to polycythemia. It is related to this hypoxemia, and the dyspnea occurs due to hypoxemia maybe. Okay. Then so we can exclude the third option also from the answer. And fourth option is risk for infection related to suppressed immune system. This is also a problem which can occur in COPD, but it's not related to polycythemia. So what is the nursing diagnosis related to polycythemia? Because of increased RBC in the blood, viscosity increases. That means blood is becoming more thick. So there is chance of clot formation. So we can give the correct answer here as impaired tissue perfusion related to thrombosis. With another topic, we will meet again. Till then, bye.